Kurt Rasmussen, Chief Scientific Officer of Delix. I hope I got it correctly, the pronunciation, okay. And Tricia McCall is also with the company, the
Chief People Officer.
Chief People Officer. Is that a new title that you that came up with?
No, that's one that's relatively new in the industry, but it's been around for a little bit.
What does a Chief People's Officer do?
So Chief People Officer, if you think of human resources, so you see here the CHRO, but the focus is more on the people than necessarily the process and things like that, engagement, culture, those types of things.
Now, I understand that your company is up for an award.
Yes.
Tell us about Delix.
Delix is a startup, a biotech in Boston-based, and what we're trying to do is develop new medicines to treat a variety of mental illnesses through the new process, the newly discovered process of neuroplasticity. Essentially, we want our compounds. Our compounds will heal neurons that are damaged from stress, from various disease processes, and it's a new approach to treating neuropsychiatric disorders. Previously, we've been treating symptoms and changing a release of various transmitters, but now we're going in and actually healing the neurons that are damaged, which is the first time in neuropsychiatry, I've worked in neuropsychiatry for 40 years, that we're really treating a pathophysiology. Completely different approach, game-changing, and if it works, it's just going to, it will revolutionize, I know it sounds cliche, but it's going to revolutionize healthcare, specifically of neuropsychiatric disorders where there's damage to neurons.
So in other words, what will go out, what will be in?
I'm sorry?
What will be out with your technology, what will be in if you're successful?
Well, I think our technology would fit in with most medications, and what we're going to do, other treatments. What it'll do is it'll be new treatment options for physicians, for healthcare providers. They can still use the existing medications as appropriate, find out if our medication help, hurt, work with them, or better. Eventually, it's the landing place of them within the treatment of patients will be determined with a lot of clinical trials, but I think we'll replace a lot of the old medications that don't work as quickly. A lot of the medications now for neuropsychiatry, antidepressants, antipsychotics take weeks to work, and then you're not even sure if they're really working. Hopefully, our compounds will work the next day.
This could be a boon for people who have mental health issues.
That's exactly right.
Depression, for example.
Depression, schizophrenia, even anxiety, PTSD, and even hopefully things like dementia. And we want they're going to produce the changes immediately, like within a day, and that will last a long period of time.
So here's a question: if somebody has severe dementia, could it be helpful to them too?
Yes, that's our hope, because like I said, we're repairing neurons, and we think we could improve someone's cognition, hopefully within a day, within a couple of days after the medication. Now, and it'll complement other approaches which are trying to slow progression of the disease. This will hopefully help.
It's not a replacement, but it'll also complement.
It'll work with the other medications. So giving more options to physicians and patients is what we're trying to do. And we hope our option will really help.
How long will the process take before it's up and available?
Well, our lead compound is in phase 1. We're very excited about that. And it's moving along well, and we'll have a clinical trial in depression within a year or so, and then we've got a whole series of compounds coming behind them. It'll be a whole portfolio, bring them in and treat different indications. Like I said, we'll go depression first, but then we'll look at a number of other indications as well.
First time with the Galien Foundation?
Yes, first time.
What are your impressions?
It's wonderful. It's nice to see all of the companies here representing so many different areas of biotech, but also internationally as well. It's nice to be there. We were at a function last night that was getting all of the folks that are up for the award for the new startup. And so it was nice to be able to, for us to connect as a team, but also for us to be able to meet so many other people in the category.
Terrific. And this so you can make sure nobody's depressed when they come to these events in the future, right? That's your job as Chief People's Officer.
That's right. Culture is important. Yeah.
Anyway, thank you for joining. Good luck on your quest.
Thank you so much.
Thank you.